anterior glide of the talus on the coral joint, on the fifth, okay? The way you position the foot, whether in plantar flexion or neutral, is going to stress different parts of it. So I'll start with just neutral, and you can take your hand and grab underneath and rest your forearm along the plantar aspect of the foot and pull it forward. But the usual test position is to control the dorsiflexion and plantar flexion with your hand on the medial side of the foot. So you grasp the foot this way. Okay. You stabilize the tib fib. Go ahead and scoot back a little bit. So if you take the tib and fib and just push it to the table, and then you lift the ankle forward, okay, this way. And you take a look to see how much motion's happening and grade that excursion, okay? Got a little bit there. Another way you can do it is to cup the calcaneus and push it forward too. So depending on the size of the foot, sometimes it's hard to grab around this. It's easier to actually shove it forward like that. Sometimes you'll see a dimple sign where when you bring the talus forward, you'll see this anterior part of the joint suck in. And that's a sign that it's unstable. The talus is moving a lot. It's moving forward, and the cap is sucking into the tib fib, and you'll get that excursion going. Okay? And you always want to compare it to the other side. And his is loose. And when I pull it in a dorsiflex position, not only does his lateral side go forward, but his medial side does too. Okay? If I go into plantar flexion and pull it, the lateral side goes forward more. Why would that be? By plantar flex, I'm gapping the anterior lateral aspect of the joint, and the anterior talofibular blocks that movement. So an anterior talofibular ligament sprain occurs in plantar flexion and inversion where it's maximally stretched. If I do an anterior drawer and plantar flexion and the lateral side moves forward more, it could be indicative of that being disrupted. And what you'll feel is that the lateral side will move forward and further compared to the medial side. If both sides move equally, then something on the medial side is affected, and that would be what ligament? Deltoid. Okay. And then you have different versions of the deltoid. The main one on that side would be torn first. It's going to be which part of the deltoid? Anterior tibio-talar. Okay. All right. So in neutral, straight drawer, if both sides move, you possibly have disruption of both the medial and lateral, some of the medial and lateral structures. Okay. If you plantar flex and glide and the lateral side comes out more than the medial side, then you know the lateral side is disrupted. Probably anterior talofibular is gone or more mobile, especially if it's more mobile compared to the other side. Make sense? Sometimes you'll get crepitus in here too if it's really unstable, and you do on this one. He's pretty grindy and grady there. Okay. All right. Let's see. You guys want to fiddle with that first? This is kind of important. So, yeah, let's.